Here, and I hope that we're going to have very exciting session. The international experience of response to COVID-19. I would like to give floor to our first speaker, to um, Lena Nanushyan, the first Deputy Minister of Health, Republic of Armenia. Lessons of combating HIV/AIDS is an example of successful combat against COVID-19 in Armenia. Thank you, dear colleagues, dear participants of the international conference. In the first place, I would like to thank for this opportunity on behalf of the Armenian delegation to participate in the conference on such an important topic on epidemiological well-being. So the pandemic of COVID-19 made adjustment to global healthcare agenda as well as to our agenda in Armenia. The healthcare system had to respond quickly and provide medical care so that nobody is left out. And here the successful examples and mechanisms of HIV and AIDS fight were helpful, and only radical measures, policies, and the redistribution of resources can help us to be out of that crisis. Some of the learnings from HIV and AIDS pandemic, which we are using to fight against COVID in our country. The global pandemic should consolidate all of the efforts, including the international community. How we could provide for the life-saving therapy, exchange of information, and the use of international platforms help us to say that after 1 year after the pandemic, we have a life-saving vaccine. So now there are no borders. The works were going on 24/7 by all of the countries. Everybody was helping each other, providing the necessary resource for diagnostics. And I would like to mention here the valuable help of the Russian Federation as well as for another pandemic, HIV/AIDS, and we were, of course, cooperating closely with other colleagues, with the colleagues from WHO, and also we had some targeted efforts which could provide for both medical care and also exclude and mitigate the social economic consequences. In March 2020, we started to face COVID pandemic. That was also important not to miss out another pandemic, which we have been combating for 3 decades. This is HIV space when we had the limitations for movements, and when the work to prevent HIV was also limited because of the limitation measures, and we needed also to distribute the specialized treatment, and we face certain difficulties, but thanks to very quick response, and also thanks to the new team of our institute and the National Institute of Healthcare, the National Tuberculosis Center, and international donorship organization and support of a non-governmental sector, it was possible to continue prophylaxis for people living with HIV, people who are on replacement therapy, and other key groups of patients. Since the very first days, the following steps were taken to mitigate the situation, and we provide for continuous treatment, and also we had the cooperating NGOs which were distributing the medicines to all of the patients all across the Republic, and understanding the spatial status of the groups under risk. So we distribute information about COVID-19 and the work of NGOs and the Centers for Prevention and Treatment for HIV, AIDS, and Tuberculosis. So also there were psychological care and other types of medical care. We used online services and video conference connection. We used the mobile clinics which were provided by the Russian Federation government under the UNAIDS program for joint prevention and express testing for COVID-19. And other measures were taken related to tuberculosis drugs to supply the anti-tuberculosis drugs during 1 week time. And all of the antiretroviral drugs were supplied within 1 or 2 months. Thanks to tough planning, there was no deficit and no shortage of drugs and no stopping of treatment in the Republic. I would like to emphasize that the potential of HIV center that we achieved over the last 10 years, we used that since the very first day to fight against COVID in our Republic. On top of that, thanks to the needs of a quick response in the context of pandemic of that we were facing, and we also assessed once again the great efforts of UNAIDS, and we started to work to identify the gaps. And also we had a questionnaire all across the Republic. During lockdown, we never had issues for people who are on ARs, and I would like to say that despite we had a very close work between governmental institutions and non-governmental organizations. We did everything to work with HIV, and we understood another learnings from our work with HIV and AIDS. And when we're working against the COVID, we need to be closer to our patients during COVID pandemic. So they were NGOs that used to work with HIV, so they were providing a lot of social support, not only providing for the needs of people who live with HIV and AIDS. And the results are so fragile. It is very important to never stop and move on. The risks of COVID are also slowing down the advancements that we have with the HIV AIDS. We all know that's too soon to say that the pandemic is over, and also we need to assess social economic losses, but at preliminary estimation we understand if we are not actively involved in fight against HIV, we not assess the situation, review it, if we not have additional incremental funds allocated, we may be in a situation when during the pandemic or after the pandemic another pandemic may become a problem. Why I believe this is important to have such discussions, and we need to work in partnership with Russia and with our international partners, UNAIDS and WHO. Today we need solidarity and political will to fight against this crisis together. Thank you for your attention. I wish you health. Thank you, Yelena, for such a great presentation, and you demonstrated many aspects and the relevance of this problem. And we need to pay attention to the most vulnerable groups of patients which suffer from HIV/AIDS. So we have 5 speakers, and the time is very limited. Those who have questions, please ask them in the end of the session. I would like to happy to give floor to MD Professor Alexandr Semenov, head of a Research Institute of Viral Infections from Yekaterinburg, with the very intriguing name of the presentation lesson of COVID-19 pandemic in Italy, because Alexandr participated in the events evolving in March and April last year, and he was on that humanitarian mission of the Russian Federation, and in the most affected province in Lombardy. Yes, thank you for such an introduction. I feel just uneasy, but I'm Doctor of Biological Sciences. We are not all of ours medical doctors. Well, this is not a perfect topic for the presentation. We often speak about biological markers, about treatment, about viral stuff, and we need to speak about international experience of fight against the pandemic, what we did in our humanitarian mission, and what the Russian Federation did at the request of the Italian Republic. Natalia is being too modest. If you look at the photo in the corner, so we may see her as well here. So we were together, and as experts from Rospotrebnadzor, and that was interesting experience. And so here I will present my opinion through how I perceive that, through my own experience. That was my first experience. And I just announced my disclaimer, and we could move on. Well, the next slide. The main thesis for this presentation is the following idea. Yes, we do here the new values are not material values, so this is the values are non-material, such as health and the criteria for assessment of life, being satisfied with life. That should include epidemiological safety, well-being. Well-being should be defined as epidemiological well-being. The power of the state is the power of the healthcare system, and it turned out that probably the standard assessment that we used before the pandemic, they do not always work based on absolute numbers, on and also ending with the physiology, and ending on with the results of some received by some scientific countries. So Italy is one of the countries which demonstrated the example of outstanding work, and also the same outstanding failures, especially at the onset of the pandemic. It seems like all of the mistakes, possible mistakes, were done by them, and the situation got out of control. And also there were 4 groups of countries based on the response of the countries to COVID. So the first are independent countries who were eager to provide for themselves and for their citizens, and they could fight against the pandemic. So of course this is China, this is Korea, and the Russian Federation. The second group, well, they are developed countries who nevertheless could not by themselves cope with the pandemic and had to ask for help from the countries which have that opportunity, and also we could have here Kyrgyzstan, Kazakhstan, Tajikistan, but still Italy was asking for help despite such a difference in GDP and per capita income. So they were in the same group, and there are several reasons for that. And the third group, these were the extreme states, so which were just not accepting that there was a pandemic, like Sweden. And of course, now this approach seems very wrong. This is the approach we should avoid. The fourth group is the most arguable. Well, these countries, they seem to provide for themselves. They are manufacturing the vaccines, and they also have the beds available, but the total number of mortalities and of infectious is high. The US, UK, France, Belgium, the Netherlands, and some other countries. And they are developed countries, and they are independent, but the pandemic there was like huge. It was grandiose. So why Italy, which is among the leading economies of the world and is very well equipped in terms of the hospitals, and also they have medical provisions equipment. They are in the second group. They have to ask for help, and this is still something I don't know, but we will try to say something about that, about the reasons for this happens. A little bit of history. The first case was registered 443 days ago, on the 31st of January 2020. Well, and as you remember from yesterday, our first case was on the 1st of March, and here in the 31st of January, now 3,900,000 cases and 115,000 deaths. It was 3-4 days ago, and the number is growing. And Italian Republic has all of the chances to be ahead of Russia in absolute numbers. As you understand, the population is much smaller. And in all of the regions, they have coronavirus cases. And also the regions with worse cases, so these are Lombardy and Veneto, the most affected, and these are the main industrial regions, so this is the industrial heart and the touristic area, so banking industry. And the richest population, and then Campania is the most affected. It's in the south of Italy, which is underdeveloped relatively, and it is densely populated and quite poor. And also we see the same results in the richest and the poorest regions. This is an interesting detail about Italy. Seems like it was all starting well, and they closed air flights with China.
But that is where it stopped, and the restriction measures were not introduced for a long time. They started registering first cases of infections, but they did not take adequate measures on time regarding introducing certain restrictions, let alone quarantine. We're just talking about mild restrictions that would cover the country. So they started limiting the movement of citizens in so-called red regions where the incidence was the highest. And at the same time, it was not done instantaneously. Instead, they would say that, okay, in a week we are going to stop moving around in that or the other region, given the fact that the incidence is going up. And what does the population do? They just jump into their automobiles and rush to other regions where still there is work. And then there is another message on the part of the government that the incidence is growing in yet another region and it is going to be closed in a week or so. So instead of containing the virus spread, they just spread it around, and we saw that the incidence in Bergamo, Venice, where traffic was really high, was going up very quickly, and instead of closing the region, they started ousting out citizens. And we know that people from poorer regions come to the north of Italy to work, and these people, as they heard of the government plans to close the regions, they decided to go back home to the south. And as a result, within 3 weeks' time, the infection spread across the whole country, including the most remote areas. So the wave of labor migrants went back home, and that is when incidence was registered in each and every region. Moreover, interestingly enough, Italy needed assistance because it turned out that due to certain reasons, the Italian Republic saw certain gaps in healthcare sector, in education sector. So they lacked experts in epidemiology, in hospital epidemiology, because these professions within the healthcare system are not of first priority, and training of experts in these areas were scaled down. And we know that in some Italian universities, epidemiology was not a mandatory subject, so the students would quickly take a basic course about epidemiology and biosecurity, and it was not a serious subject, and that would imply practical lessons, practical classes. And that has been true since 1996. Why so? Because incidence of certain infectious diseases was sporadic and outbreaks were minor, and typical epidemiologists would focus on virus, hepatitis, AIDS, and so on. But the country has not seen large-scale pandemics, and therefore the knowledge in this area was not spread around the entire medical community, and advanced training courses would not include this subject. Well, we were surprised about that, and we would ask our Italian counterparts again and again why this actually happened. Well, they would tell us that pandemics was not really a hard case. Yes, there is the Institute Superiore, but again, this is just one facility that is supposed to cover the entire country. Can I see my next slide, please? So besides the organizational matters, there were also political reasons, and we all know that any successful endeavor when it comes to fighting the pandemic requires mobilizing society at all levels, and certainly there should be political will in place, and politicians should demonstrate the willingness to counteract outbreak, no matter how unpopular the measures would be. Well, Italy demonstrated confusion when it came to introducing restricting measures on the part of the government, when it was high time to introduce limiting measures, when it was high time to cancel events that did not happen instantaneously. So football matches were not cancelled, although incidents had been registered for 20 years, especially in Milano, where the incidence was the highest, and that was the hotbed of the infection. Well, you know that football is almost like a religion in Italy, and there was an important match between Juventus and Roma football clubs, and that brought together thousands of fans that came from all over the country. And you know, the decision on canceling Venetian Carnival also was quite belated. We understand that economically it's a very important event, but if we look at the incidence and its growth, we understand how quickly the wave of the pandemic would spread, and that again enhances the fact that the interaction between the medical community and government should be not based on recommendations. It should not look like the following: why don't we close the festival? Well, let's do it in 2 days. Let's still let people enjoy their high sales. Well, when it was finally clear that the situation was way out of control, and indeed the incidence was horrific, and the increase of infected cases was just overwhelming, and you remember that last year we were reiterating again and again that it was very important for us not to let same situation happen. And we understand that when all infected people spread the virus from Lombardy across the whole country, look, you see, I saw Colosseum without a single tourist. There are very few people who can both having the same picture when you can walk around Rome, and it was completely empty. I remember together with our military guys, we were going to our point of location, and we were allowed to stop for 1 minute and take those pictures. An unprecedented event happened against that terrible background. The Italian government allowed the arrival of Russian military doctors, our emergency medical professionals, our epidemiologists, and others, and they carried out anti-epidemiological measures, and they worked in the region that was hit the hardest. That is the city of Bergamo. Next slide, please. So we were able to streamline the process of PCR diagnostics. We validated Russian tests together with our Italian colleagues. We also conducted the trainings on infectious control, on following up the patients, also training on disinfecting measures. By the way, similar trainings had not been conducted before, what really made us feel very surprised. And here you see we were dividing the hospital into zones, and this hospital was organized de novo in the Expo Center of Bergamo, and once it was rolled out and launched, our experts together with Italian colleagues started working there together, and that was unprecedented experience, and we shared all our best practices. And we know that by that time 70% of medical personnel of Italy got infected. There were 0 cases among the Russian counterparts. And that again is telling about our practice and tradition of infectious control. We know that Italy was close to putting an end to pandemic in its territory, but it did not finish because restricted measures were lifted, and now they have the incidence that is even high. That at the initial stage, of course, a shortage of personnel is still a large problem, and we know that still there is strong anti-vaccination lobby that is supported by the Roman Catholic Church. And there is some tension between the medical community and the lobby with engagement of mass media and politicians. So here you see what happened after lifting quarantine, and you see from almost 0 mortality cases, we would see the sharp increase. And as for vaccination trainings or vaccination program, we know that it is based on the European Union approach. So you have to be registered for vaccination as a member, as a citizen of European Union, and you can be in line number 32 million. Can you imagine that? And that is unprecedented for Russian Federation, although, of course, the speed is accelerating and popularity of vaccination certainly is high, but people still have to wait in line and have as many as 32 million people in front of you. And, of course, Italian colleagues paid attention to our practice, and they understand that thrombosis treatment in regard of treating coronavirus infection is very important. And well, in April and March 2020, Italians already actively use schemes to block so-called cytokine storm. Okay, the click is working. And I understand that I'm out of time. I should say, wrapping up, that we certainly make very important and serious conclusions. And, well, conclusions are on the slide. I don't have to read them for you. You can do it yourselves. But seriously speaking, this experience of international cooperation demonstrated once again that when professional medical matters are of high importance than the political ones, then despite all tension between the countries, you can succeed. And Russian military doctors, together with Italian doctors, can work very well, very efficiently, and can learn so much from each other. And I hope that we will have a larger number of projects of this nature even when the pandemic will end. Thank you very much for your attention. Well, dear Alexandr, thank you for this exciting journey into the events that took place a year ago in Italy. And it was an assistant, but also great experience for us, because in the Russian Federation, we had very few cases of registered cases of coronavirus infection, and the experience of rolling up mobile hospitals on the territory of, let's say, export centers or large vacant facilities like it happened in Bergamo was instrumental. And Italians were the first who started talking about thrombosis, absolutely, because Lombardy has a very high percentage of senior population, and they had lots of patients in senior facilities, and you see many people in Europe very often upon their retirement move to Italy because the climate there is so favorable. So we didn't have that percentage of pensioners among our patients, but they did. Yes, absolutely. And the therapy with the use of anticoagulants was included in our protocols as well. And we took a different approach on using hormones, because prior to that, hormone therapy was not recommended for treating COVID. Well, once again, thank you very much. We will let you go. And now we would like to hear a message from another member, that is the head of the mission of Rospotrebnadzor of COVID, that is from Uzbekistan. And I give the floor to Doctor of Medicine, Tatiana A, who is the deputy head in medical area working in the institute named after Gabrichevsky. Hello, dear colleagues. Indeed, interaction and cooperation with other countries is instrumental and invaluable for us, because it's not only us who are ready to share all our data, all our best practices in order to provide help to our colleagues overseas, but we also, in our turn, learn so much, and that is what we really need very much. Every time when I have a business trip, I saw different objectives. And working in Uzbekistan, we were tasked with solving an issue of treating very severe cases. So when we got an inquiry from the Ministry of Health of Uzbekistan, we saw a high number of severe cases, a great number of patients that had repeat hospitalizations, hospital admissions, and that meant that hospitals had 100% occupancy, and emergency aid units were extended by 100% in terms of their capacity. So if typically they would have 8 to 9 people, they would house 16 to 18 people, and still this was not enough. And artificial ventilation units were not sufficient for the Republic, and the situation was very challenging. We composed a delegation for the business trip that included the experts from a Russian surveillance agency from Moscow, St. Petersburg, Volgograd, that also included experts from the Ministry of Health, and it even included counterparts from other countries like China and Germany. So we wanted to understand what was the reason for such severe courses of disease among such a great number of patients. So we worked at 7 hospitals in Tashkent region, Samarkand and Samarkand region. We also analyzed activities of medical professionals in outpatient clinics. We analyzed work at the labs in the Republic of Uzbekistan. We were actively engaged with our counterparts in the Ministry of Health of Uzbekistan and with the Embassy of the Russian Federation. We analyzed all admission work in all admission units for COVID patients in Tashkent and Samarkand, and focused on treating and following up patients with severe course of the disease. So again, we analyzed the reasons for such severe course, and we had detailed talks with all the doctors and looked on one hand on shortcomings in diagnostics that would cause the spread of the disease, and that would exacerbate the course. And we also looked at efficient ways of using the equipment, because after all, when using artificial ventilation units are associated with certain specifics, and we understand that improper use of those pieces of equipment may cause certain bad conditions. So we held 8 conferences and passed our recommendations and conclusions that indeed were quite general on one hand, but we understood that recommendations were specific for each unit, and we held meetings and discussions for every single facility in order to increase the understanding of the situation in the Republic. One of our proposals that was the following, that is to carry out auscultation without wireless phonendoscopes, and that would help to diagnose developing complications like pneumonia or arrhythmia, myocarditis, and that would be possible without using additional equipment, because we understood that the new facilities were short of equipment, even the ones to carry out ECG, let alone computer tomography. And this method allows to carry out differential diagnostics very quickly, and it's not time consuming. It does not require moving around of the patient. It can also prevent the risk of infection for the medical personnel and for other patients. So that means that you don't have to move that patient around. So every doctor that we saw received information about measures of personal protection that was very important from our point of view, and we saw core reasons that would cause such a large number of severe cases. And what did we identify in this regard? We have identified core reasons that would substantiate the spread of disease and would provoke the severe course. So first of all, that is not timely or improper diagnostics. So we understood that the quarantine measures were followed only within 10 days, and the lab diagnostic was carried out way too early after the contact, what certainly was one of the reasons for spreading the disease. Because if you analyze the biomaterial on the 5th or the 8th day, so that you could receive the result by the end of the 10th day, we understood that at this stage, certain patients would not demonstrate signs of disease, while others would not have any symptoms, and the incubation period could last longer than 10 days, and then the transmission of the disease would take place after the 10th day, when the quarantine measures for a certain patient would be lifted, but this patient would contact a large number of people and contract others. So we recommended that the isolation would be extended up to 14 days, and the lab diagnostics would take place at later stages in order not to miss out any cases. Of course, a large problem at that point was in the following. Many patients would go to admission units without PCR positive result, and they would have different pathologies like like congestive pneumonia or other infectious diseases, and they would not be isolated from COVID patients. They would stay together with all COVID patients, and would we understand that the air in the hospital would not be treated, and then the patients without COVID would develop COVID as well, COVID triggered pneumonia, and that certainly would imply very severe course of disease. And the patients without negative PCR diagnostic, of course, would have to stay in the hospital, and we understand, on the other hand, the traffic in hospitals was so high, the doctors would be forced to discharge patients even without PCR test, and that certainly would contribute to spreading out infection further on, and actually these patients would be re-hospitalized and would add to the workload, to the burden the hospitals already suffered from. We also understood that many doctors did not have any means for personal protection, and some doctors that underwent COVID would ignore the recommendations to use protective measures. And we understood that even if they would not develop the disease again, they certainly could transmit the disease, and certainly it could be another contributing factor for increasing the incidence. And also there were quite many contradictions or non-substantiated approaches to therapy. So we saw wrong use of, improper use of anticoagulants, antiviral medicines, etc. And this is another area where we provided our recommendations. And what results did we receive? Well, the largest or most significant result that demonstrates the efficiency of our work, and I would like to emphasize that again, this result is based on contribution of many colleagues of ours, including those working for health, Ministry of Health and other agencies. So the largest result was that the number of infected people went dramatically down, and that meant that even newly opened hospitals, except for one, could be closed. So this situation was under the control, and we should say that we still keep in touch with our colleagues, and again we can see the results from introducing the measures, and here with arrows you can see when we were engaged, and you see the decrease in the number of infected people. But we understand that at that particular point there was a shortage of personnel. Then there was another increase in September, and that is when additional diagnostic measures were introduced, and then following that you can see an obvious decrease, and at that point, when many countries saw dramatic increase in incidence, that is October, November, and December 2020, the educational facilities in Uzbekistan could continue working. Many shops, stores were open, and restrictions were not significant, and the mortality rate was also quite low. Of course, we have done a great deal of work, and the recommendations that were introduced, of course, have to be adjusted individually when it comes to their use in each and every hospital. We still hold joint conferences online. We analyze severe cases. We analyze new approaches when it comes to treating patients with COVID-19. And of course, in my opinion, we worked with many colleagues in different countries.
And according to such experience, when we have close communication and cooperation, when we are talking and discussing all of the problems, when we introduce the objective and effective events and activities, so we can successfully control the spread of COVID-19. Thank you for your attention. So, dear Tatiana, thank you for such an interesting presentation. And the most important thing is the transfer of the Russian experience and in care for the patients and for diagnostics is continuing until now. And I think you will also provide support for them in the future. Now our next presentation, which will be done by Esmira Amamedova from the Republic of Azerbaijan. Experience and less of HIV test and treatment during COVID-19 pandemic. Dr. Esmira. Good afternoon, dear colleagues and dear participants of the conference. To our great regret, we could not participate personally in the conference, but over this year we just got used to being online, to communicate online. In the first place, I would like to thank the organizers of the conference for the invitation to share our experience, how we fought against the pandemic, what were our lessons learned. And we had to go through serious challenges because COVID had a negative impact on all of the spheres of life, economy, labor, education. But despite the crisis due to the pandemic, the efficient ways how to solve these problems were found, and this is what I would like to speak about. Well, introduction about epidemiological situation in our country. For HIV, the estimated number is 60,000 people, users of drug, men having sex with men, 24,000, and sex workers 32,000, and in prison 18,000, which positive 8,688. Out of them, 96%, almost 8,395 are citizens of our country, and 1,093 died, and the prevalence of HIV per 100,000 is 5.2. Which testing? HIV testing is one of the priorities of our national healthcare program and the program for the fight against HIV. And we have a centralized tender and our healthcare ministries procuring the tests, which are given away in the future for free to provide testing in 48 stations and in 12 mobile stations. All of the labs in the country. Every year they give information about the number of tests to HIV center, and this information is accumulated there, and it's further on given to the Ministry of Healthcare. And the analysis of the total number of cases demonstrates that compared to 2019, the number of tests decreased by 22%, sorry, and also we have the same number of new cases like in 2016. The most critical were April, May, July, and November 2020, when the number of tests decreased by more than 2.2 times. And I would like to share our positive cases as well. The number of tests for TB patients, it is increasing and amounted to 119%. And there should be some explanation for that. The colleagues from NTTB having a long-term experience of testing of HIV for TB, and it gave its positive results. So the total rate is stable compared to 2019, but the decrease in number of tests we did not see. Another important aspect of our work is epidemiological survey for HIV. Before end of March, in Q1, everything was as expected, and the number of cases in March compared to 2019 was higher, and it was 114%. And in April, there was a decrease 42-43% in May. In July, there was a decrease by 71%. And it's all logical, and we needed around 4 months to come back to normal work. And in August, we came back to pre-COVID numbers. And there is a decrease by 25% in the number of cases, and then by end of the year we had certain improvements, and the decrease was by 22%. What was the reason for such a situation? So no readiness for the pandemic. The fear among the medical workers and absence of experience working in emergency situation, limitations of movement because of the quarantine measures, and almost all of the healthcare institutions and hospitals were working only with COVID patients. And also the outreach services were added upon. As for ART therapy, antiretroviral therapy, so that's not so bad. In the Q1, Q2, when we had that situation with the lockdown and with the limitations, in Q4 we managed to change that situation, and the number was decreased by 17%. As for the coronavirus pandemic in the country, the first case was in the end of February, and the first death was in March 2020. And most of the cases were imported and started from April. So the local transmission of infection was present. In March and April, we still had illusions that that was temporary and very soon it's going to be over and there won't be such a spread of COVID pandemic, though it did not happen. And because of COVID pandemic, there were limitations introduced on top of the quarantine, the lockdowns, and it caused the limitations in movement, and the most affected regions were blocked, and also the module type hospitals were opened, and all of the doctors, including infectious doctors, were used for COVID, and we faced the following challenge as a result: a sharp decrease in screening tests for COVID, impairment in the work of most stations of testing, and also the main hospitals, central hospitals, they were used for COVID, and over 50% of the preventative stations and also HIV points, so they were not operating, and 6 ART centers were created. They were covering most of the regions, and all of the infectious doctors, they were working in the hospitals with COVID patients. Also there was a danger that our patients with HIV/AIDS, so they may face the danger of shortages of supplies with ART drugs, and also there could be deviations in the monitoring system of treatment. And since 2014, we had the replacement therapy with methadone. We were also facing the problems with access to methadone. What was done finally? And we had to quickly adapt the prevention and treatment services. And also, of course, we made some awareness campaigns, and we introduced the online consultation awareness for outreach workers, and also for those who work with life-threatening conditions. So the info materials and brochures were prepared. They were given away to all of the NGOs which were doing the work. And also most of the non-NGOs, they had no experience of working in emergency situations. So we had to do HR training on infectious control and safety. We received a special documents, certificates to provide for their movement in the country. Also, we had to prevent accumulation of a lot of people in the station, and the mobile brigades which worked with the key groups of the population, they were also involved in delivery of medicines at home, monitoring of treatment, together with testing and informing, and also the instructions on ART treatment, they were reviewed and changed. So we introduced home delivery, and with the help of other patients, even from one village to another, you could not travel. And ART were delivered on time in complete volume. And for the third year in our country, we are ordering and procuring ART with the help of UNDP, and all of the logistic issues were solved timely. And if in 2019 the number of patients which had the drugs for 6 months, so it was only 3% in 2020. So this number, at the end of the year, achieved almost 20%. As in June, the guidelines on ART were changed. If before that we would take into account only how long the patient was on ART, and if the patient mentioned that this is a labor migrant and he had to move out of the country, so only because of that he could receive it for 6 months, to avoid stopping the treatment, to have timely medication to avoid the COVID risks. The patients were provided with the medicines from 3 to 6 months worth stock, and they used our regional labs for delivery and other means. So in this slide you may see how the delivery was performed to the patients. So how we were given that all of the documents were filed, and this is how we avoided the risk of COVID transmission to people with HIV. Dear Smira, we are about to finish our session. Please round up. In the end of my presentation, I would like to say that our experience which we received during the pandemic well, that it is important to use the practices that we acquired in 2020, how we managed to avoid any negative impact on incidence of HIV. We need the new methodology for fight against HIV in COVID pandemic conditions or in conditions of have another infection. We need to also train the quick response team to expand the services online and introduce testing for the key groups for HIV target groups and for COVID as well. And we received several calls. We'll do the testing of the main target groups, not only for HIV but also for COVID. Thank you for your attention. I wish you to be healthy and successful. Thank you very much for such an interesting presentation. You can see that in Azerbaijan there were some difficulties like in other countries, and as far as I understand, you managed to overcome those problems, and also you restored the level of medical care to our patients. Now I would like to give floor to Maria Shibaeva, senior specialist of intellectual property ITPC Russia. The presentation is called Reforms in the Field of Intellectual Property Aim to Improve Access to Drugs During the COVID-19 Pandemic. Dear speaker, please not exceed your limit because we are supposed to be finishing.
Хотела бы поблагодарить
And I would like to thank the organizers for the invitation to speak at the conference. Our presentation will be about reforms in IP aimed at improvement of access to drugs during COVID pandemic. As with the spread of the new COVID infection, and also so there were some shortage of drug provision, so we had to accelerate the innovations in medicines and vaccines to expand production to procure all of the necessary medical products. And at that time what started to be actively started, so the well-known medicines, so for other diseases, including HIV, hepatitis C, and they demonstrated certain efficacy for COVID-19. And some of those medicines were protected by the patent. What prevented this global distribution of medicine? International legislation can use provide the opportunity for the use of medicine without being owner of the patent, but some shortages in legislation about unpatented medicines in emergency situation prevented them from doing so. And one of the barriers in terms of access to medicines was a shortage or absence of experience in the use of TRIPS flexible regulations, and also related to licenses and licensing, obligatory licenses, forced licenses, and without the authorization of a patent owner is completely legitimate. They are described in the trade agreements, and one of the first countries to respond by legislational change was Canada, and so the law on the emergency response to COVID was issued. Healthcare Ministry, according to that law, can give the permission to use medicines or medical products without the consent of patent owner. The same was done by Germany. They made amendments to the law on prevention of infectious diseases and fight and treatment of this disease. And France added an article to the Code of Public Health Care. The Prime Minister can take any measures to provide for the necessary medicines to the population. And in Chile, and there was the declaration adopted, special resolution
that said that the global coronavirus pandemic would substantiate the use of mandatory licensing, and the European Union did not stay aside, and they have developed the plan of action for intellectual property, and one of the goals for that action plan was to remove barriers for introducing generics in the market. Also, in October 2020, two countries, India and South Africa, asked WTO to suspend the action of 4 sections of TRIPS agreement related to the intellectual property, industrial samples, patents, and the protection of confidential information. And Russia also demonstrated certain dynamics in terms of developing legislation. In early 2020, the State Duma has introduced a draft law and changes for the civil code of the Russian Federation that said that the Russian Federation government can provide approval for developing the medicine in the interests of the life protection of the citizens. And that approval would cover the use of inventions, and this law is applicable for the healthcare sector. Beside legislative initiatives, 2020 was associated with 3 mandatory licenses issued for COVID-19 medicines. So in March 2020, Israel issued mandatory license for Lapitavir and Ritonavir. It's demonstrated efficiency for treating COVID, but one company, the patent owner, did not have sufficient capacity, so the Minister of Health provided the approval for important generics, thus providing sufficient number of volume of medicine for the citizens of the country. In late 2020, Hungary issued a mandatory license for use of remdesivir, and Russia in December 2020 also saw the issue of a directive from the government of Russian Federation to use remdesivir without the consent of the patent owner. And in summer 2020, when remdesivir was believed to be efficient, the United States bought the entire stock of that medicine. And at the same time, in order to provide the access to this medicine, the patent owner Gilead provided access to all countries except Russia, and therefore Russian Federation did not have opportunity to use either branded medicine or use generics, and therefore the government just granted the approval to Pharmacintas company to manufacture this medicine. And besides mandatory licensing, there is also such a phenomenon as freewheel licensing, and in 2021 Russia has concluded a number of agreements with more than 10 countries and would allow to manufacture our vaccine Sputnik V. Now we are providing the transfer of technology, what means that these 10 countries will start manufacturing the vaccine our vaccine in the very near future. And looking up at our core conclusions, we can see that some countries have changed the legislation so that they would be able to use a mechanism of mandatory licensing efficiently. The Russian Federation has implemented a complex approach that is promoting the draft law, and also it has granted approval to use remdesivir without the consent of patent owner, and also has concluded license agreement for manufacturing Sputnik V. And I also would like to pay your attention to the fact that following use of flexible terms for trips is important not only for COVID pandemic, but also for treating such diseases as HIV, hepatitis C, tuberculosis, etc., etc. Thank you very much for your interesting report. Indeed, the question of licensing and using the medicines that are not registered yet in this or the other country of great relevance, especially against the background of pandemic, especially when it is necessary to make quick decisions. And I think it was the first time in the history of our country when we had to make those expedited decisions. And we are moving on to the last report, and I'd like to give the floor to Zaldi Dumova, who is the coordinator of a program she's from Kazakhstan, and she will talk about the role of multisectoral body in developing and implementing program on softening the repercussions of COVID-19 for patients with TB and HIV. Dear participants, I'm very happy to welcome you all at this conference. Allow me to highlight the role of multisectoral body that coordinates all the processes related to HIV, tuberculosis treatment, and also softening repercussions of COVID within the past year. Kazakhstan, like other Central Asian countries, still holds to their commitment in counteracting HIV and tuberculosis. Here you see the list of declarations that are the driving agent for all our endeavors. Of course, the list is far larger and is supplemented with all the decrees that are taken by the government. In order to achieve all results and goals, proper coordination matters. So coordination of all operations according to the plans. That includes coordination for preparing national reports on progress, the inquiries for financing, and so on. And of course, here you need to have authorities that allow you to do review at high level. The coordinating body provides a multi-sectoral approach and partnership. The coordinating body includes representatives from ministries and agencies that work with specific categories of population, committees on religious issues, parliamentary platforms, and a multi-sectoral approach is provided with the participation of representatives from all agencies at high level. And also it is very important to have a proper structure in place. What do you need to have in place? Authorities to remove all the gaps and make joint decisions. We also need to have factors of impact on different ministries and agencies. And here you need to have an authority to exercise surveillance and control in terms of following, monitoring political commitments. And you need to have proper human resources available to provide for sustainability and functionality. Here you see the example from Kazakhstan, where the country coordination committee works with the approval of the Minister of Health. And here you see that the coordinating body has representatives from 8 segments, and all representatives are from high level. And here you also see representatives from NGOs, from some financial organizations, international organizations such as Women Living with HIV, with TB, and so on. And of course, we follow the strategy of gender equality as one of the goals of sustainable development. And as for the organizational structure, the head of the is the Minister of Health. Deputy is the representative of international organization. In our case, this is a representative working at UNAIDS, and second deputy is a representative from NGO, from the agency that works with people that take injection drugs. And the surveillance committee develops the programs and plans. Not long ago, we have established a group for developing projects to alleviate ramifications from COVID, and the main executive body is surveillance committee that oversees the execution of all projects, and during the restrictive measures, the key role to support coordination between and communication between NGOs and other agencies was played by the surveillance committee, and it was instrumental in providing the medicines for all patients and identifying gaps in cases when some regions suffered from delays in delivering products. We are talking about opioid replacement therapy. So the committee informs the relevant bodies and helps in organizing the shipments and helps in removing barriers, and that way we were able to stick to our commitment.
And also, we cooperate with the national programs for HIV and TB, and with the local executive bodies which are responsible for TB and HIV projects in the region. And we put together all of our efforts to provide for maximum coverage. We identify the needs and also work together to achieve the results. And the representation of different sectors and more clear proportion can prevent a less efficient decision of multi-sectoral or body and eliminate the domination of one and the same group in discussions. Representative of the key population groups and people affected by the disease, so they have more chances here to be heard by the decision makers. And absence of the mutual understanding between the members of the multi-sectoral body and the impact of organization, the conflict of interest also prevents for efficient decision, and the ethical code is important. And the reliable independent secretariat is more important here, and also the financing by the independent sector is more important, so the decisions are really independent. And also sometimes we have unexpected journey, and the multi-sectoral body is at the same time sustainable and adaptable, and multi-sectoral body may be decisive for the success of the programs. That is sustainability. This is the most important mechanism for inclusive decisions. Thank you very much. That's it. Result D. Thank you for such interesting and relevant presentation. Conditions of the pandemic. The structure which provides for coordination between the sectors is important, very important, and the fate of different projects depends on that. Thank you for being with us. And as we exceed our time limit, I have a suggestion. Those who have questions, you may just approach our speakers and ask them. Thank you. Thank you for your attention.